my name is Hannah Bacon, and I've been working with Dr. Connie Mixon this summer, and today I will be presenting a link between environmental injustice and COVID-19, a case study of Chicago and Milwaukee. This study examines the correlation between environmental injustice and COVID-19 in Chicago and Milwaukee. The study hypothesizes that segregated communities of color in both Chicago and Milwaukee will have disproportionate levels of particulate matter and higher rates of COVID-19. So redlining has been prevalent in both Chicago and Milwaukee since the 1930s, and although we've seen some demographic shifts, we still see those basic patterns of segregation in both cities today. And this is demonstrated in these recent maps of the African American population, where you see a high concentration located on the far south and west side of the city of Chicago, and on the far north and central north side of the city of Milwaukee. And this is also seen with the Hispanic population, as they are concentrated mostly within the northwest and southwest ends of the city of Chicago and in the south side of Milwaukee. Segregation intersects with many different issues, and COVID is not immune to that. There are some maps that I pulled last week, and if I were to pull these maps back in the beginning of COVID, say April, then there would have been distinct lines that show higher rates of COVID in historically segregated areas such as African American communities. Now we see that COVID is spreading across both metropolitan regions and are having higher spikes in Latinx communities. And I was always intrigued by the connection between race and COVID-19 outbreaks, and that kind of drove the beginning of this study. But being an environmental science major, I wanted to add a little environmental aspect in here, and that's where particulate matter comes in. So here are some screen captures of particulate matter exposure via percentile. So Chicago and Milwaukee, very urbanized, very dense population, and have a long history of industrialization. So their levels of particulate matter exposure are extremely high. If you were to compare these cities to, say, Springfield, which is another city in Illinois, it would only range to the 28th percentile. If you were to compare Milwaukee to Madison, which is another city in Wisconsin, it would be in the 33rd percentile. So this shows that the air quality in Chicago and Milwaukee all around is just not as good as it should be. So getting into the methods, this is a screen capture of the mapping system that I use, which is free, provided to the public via the EPA. And I just chose Elmhurst for some context. That's us. So obviously I was utilizing the areas of Chicago and Milwaukee for each mapping process. The first step was to divide the city of Milwaukee and Chicago into block groups, which would be like the north side, the west side, etc., and take just particulate matter exposure measurements there. I would then, in the second step, use those same block groups and that same level of particulate matter exposure, but factor in the level of minority exposure to particulate matter, so taking into account the environmental injustice index. The last thing that would occur here is there would be 3 zip codes picked from each city that had the highest concentration of African Americans, Hispanics, and whites. Then I would compare the amount of particulate matter exposure and COVID-19 positive test results. Before diving into the specific percentiles, let's talk about what our baseline is here. And that's EPA region number 5. So the country's divided into 10, but number 5 includes both Illinois and Wisconsin. So when looking at particulate matter in the percentiles, we're going to always measure that along the baseline, which is stated down below, 8.63 micrograms per cubic meter. So any percentile above 50 would be higher than the regional average. And that's exactly what we're seeing in the city of Chicago. There are very high percentiles of particulate matter exposure everywhere. However, we see on the west and southwest ends of the city, they're extremely high in the 96th to 97th percentile, which corresponds to their non-white exposure, which is equally as high. In this, specifically with the West, you see this contrast with the Central District, as their particulate matter exposure alone is at around the 90th, but their particulate matter exposure with non-whites is only in the 42nd. And that's due to their lack of black and brown people living there. It's fairly white, and that can be traced back to a past of segregation. Milwaukee follows these same trends as the central north, central south, and north side all have the highest levels of particulate matter exposure. And this is typically where African Americans and Hispanics reside. So now moving on to the specific zip codes selected, these were chosen as the most segregated zip codes in the cities of Chicago and Milwaukee. So we see the highest concentration of Hispanics, of African Americans, and of whites in each city. We see that with Pilsen and Auburn Gresham in Chicago, they do have a higher percentile particulate matter, but it's not drastically higher than Edison Park. However, their COVID cases in Auburn Gresham and Pilsen are much higher. There's actually almost an 8% difference between Edison Park's positive cases and Pilsen's positive cases for COVID. Milwaukee follows these same trends, but it gets a little tricky when you look at Bayview, which is all white, or typically majority white, but they have the General Mitchell International Airport within their bounds, so that's a high emitter of particulate matter. So that's why their index is a little higher than Arlington Heights. However, their COVID cases follow suit, with Southgate and Arlington Heights having the highest amount of exposure there. This data supports my hypothesis that there are higher levels of particulate matter in COVID-19 cases in segregated communities of both cities. In order to strengthen this conclusion, I would love to get some more GIS experience under my belt to really make my maps more precise. I would love to see stronger COVID data, as federalism and the variations between states has made it a little tricky to calculate. And also, there is always room for human error within this study. And this research is vital for the health of our cities, and it demands that we address this, as segregation has proven itself to be the main root of environmental injustices and now COVID-19. So in the future, I would love to turn this into a 490 credit, utilize some more data that COVID-19 will hopefully have for us, and bring in some more environmental factors such as recycling and plastic use, complete a full paper, and apply to outside conferences. Here are my sources. And with that being said, thank you for your time. If you have any questions, feel free to reach out, and have a good day.